Alrighty, let me share my screen. Okay, hello, my name's Elizabeth Freudenberg, and today I'm going to be talking about the rationale for prone positioning. Um, we have already gone into this quite a lot. I just kind of want to go over it again and emphasize some of the key points. So, prone positioning, here, I'll move this over. Prone positioning takes excess pressure off the patient's lungs so that more air can adequately oxygenate throughout their alveolar capillary membrane and participate in gas exchange. So, anytime, think about how we talked about gravity, right? And sometimes gravity really works with us, and then other times gravity really works against us. Well, in the same way, how your body is positioned, it's going to affect your pressure, just like your pressure is going to affect gravity, right? And they all kind of work together. So some indications for prone positioning, I would say first off is patient needs. So if the patient isn't oxygenating well, they're not ventilating well, they're not able to participate properly in gas exchange. Um, this is often a patient with acute respiratory distress syndrome, or a patient that is severely obese, or maybe they have pulmonary emboli, um, or just other things going on. They could have a lung mass, anything that is prohibiting, proper oxygenation and ventilation. Um, and oftentimes you'll see that they're intubated, mechanically ventilated, or they're on like a BiPAP or something to that degree, and they're still not oxygenating and ventilating despite um, being either intubated or, on some type of non-invasive ventilation. So some contraindications, obviously, if the patient has a spinal issue, like some type of spinal fracture, maybe they have like kyphosis or scoliosis, or something where they can't really lay on their stomach in that way, some type of lumbar puncture. Um, I actually recently saw a long bone fracture, a really bad tib fib fracture. So that made me think about that and how, you couldn't prone that patient. Or a patient that maybe had just gotten like some type of abdominal surgery done, like if they had diverticulitis, and they had to have a surgery that, kind of cleaned everything out, clean their colon out. Maybe they need to go back in for another surgery. They would keep their, abdominal cavity open. And so that would prevent us from being able to prone them, anything like that. These are just some pre-term considerations. So the role of the RT is the airway secure. Um, and sorry if you hear that in the background, it's just my dog. He's just playing. So yeah. Um, so before we're going to prone the patient, right, there's some things to consider. First off, is the tube secure? Is it at proper depth that it should be at? Does the patient has the patient already gone to CT? Have they already done their lab work or whatever needs to be done for the day, or their sputum sample has been collected? Has the nurse already secured their lines? Are their lines all pulled over to one side? Is everyone in place, around the bed to help move the patient? Do we have enough people based off of the patient's size? Um, is the RT at the head of the bed ready to give the count? These are just all things to consider. This is a prone position therapy checklist. So kind of like what we just went over, just making sure that before you turn the patient, you have all your supplies, everything's ready. I would say making sure that you have an ambu bag, you know, in case of an emergency, in case the tube gets compromised. Um, you know, having tape if in case you need to like retape the patient's mouth. You know, maybe having another RT with you so they can one person can hold the patient's head and the other person can get the tape ready and set it up. Um, you know, just kind of like what I just said before, like having nurses available to make sure the patient is cocooned as tight as possible and that you're able to, you know, move them. You have enough people to move them over to the edge of the bed so that you can turn them and then put them into swimmer's position. Um, and then the other one is just a checklist for returning them to supine position. Oops. Let's see if I can go back real quick. Here we go. Okay, so the effectiveness of prone position and swimmer's position. So kind of like what we just mentioned before, prone position can really help with just increasing perfusion throughout the body and allowing proper ventilation and oxygenation, despite maybe whatever issue is going on at the time. Swimmer's position, from what I read, like having the patient's arm up, it kind of and their head turned, it kind of helps prevent injury for one. You don't want any skin breakdown, so it helps like avoid that. And then also their arm being up like this and to the side kind of takes pressure off of the chest. This is a rotoprone bed. I couldn't find a picture that was like big enough, so I just put in a bunch of pictures to kind of just show it. But basically, it does exactly what proning a patient would do, except the patient's more cocooned, right? They're like kind of cushioned all around. Instead of being in blankets, it's like this thick mesh. Um, and then the machine like rotates them. Um, I don't know, like I've never seen this before. I know I've only done clinical, so I have very limited experience. But I've seen beds that will rotate the patient back and forth, but not at this level. So it'd be really interesting to know, like, to what extent a patient would need to be at in order to meet criteria for one of these beds. And that is it. Thank you all so much.